Glucocorticoids are a group of steroid hormones, which are secreted by the two adrenal glands that sit like hats, one on top of each kidney. Each one has an inner layer called the medulla and an outer layer called the cortex. The adrenal cortex secretes different corticosteroid hormones, like glucocorticoids, under the control of adrenocorticotropic hormone, or ACTH. Normally, the hypothalamus, located at the base of the brain, secretes corticotropin-releasing hormone, known as CRH, which stimulates the pituitary gland to secrete adrenocorticotropic hormone, known as ACTH. ACTH then travels to the pair of adrenal glands and binds to the ACTH receptors on adrenocortical cells. This causes the adrenocortical cells to release the glucocorticoids from the zona fasciculata, which have powerful anti-inflammatory and metabolic effects. These glucocorticoids have a negative feedback effect on the hypothalamo-pituitary-adrenal axis, meaning excess corticosteroids suppress the release of both CRH and ACTH into the circulation. Now, once made, glucocorticoids enter the circulation and travel via the blood to reach the target cells. Steroids are lipophilic molecules, so they cross the cell membrane, enter inside the cell, and bind with a cytoplasmic receptor protein called a glucocorticoid receptor. Now, this glucocorticoid receptor complex undergoes some structural changes, which allows them to enter inside the nucleus and bind with the glucocorticoid response elements, or GRE, on the chromatin. Now, this includes transcription of specific mRNA that's used to synthesize different proteins, which in turn modifies various cell functions and metabolic effects in the body. The most important glucocorticoid in humans is cortisol, and it's generally released during times of stress, like during an illness or starvation. Cortisol helps to regulate both the immune response as well as cellular metabolism, like gluconeogenesis. With regard to the immune response, cortisol promotes an overall anti-inflammatory state by inhibiting the two main products of inflammation, prostaglandins and leukotrienes, as well as inhibiting interleukin-2 production by white blood cells. Now, for cellular metabolism, cortisol promotes overall catabolic effects on the body. In peripheral adipose tissue, cortisol triggers lipolysis, which is the breakdown of fats into free fatty acids. In the muscles, cortisol stimulates proteolysis, which is the breakdown of proteins into amino acids. Often these free fatty acids and amino acids serve as a substrate for gluconeogenesis, a process where the liver cells produce new glucose molecules from non-carbohydrate sources like amino acids and free fatty acids. High cortisol levels also increase insulin resistance in tissues, which means that insulin becomes less effective at moving glucose into cells, leading to an increase in blood glucose levels. The increased glucose level also stimulates the release of more insulin, and because this is similar to what happens in people with diabetes, this effect of cortisol is called diabetogenic. The end result is that we have a lot more glucose in the blood, which can be used as fuel during times of stress. Finally, cortisol also plays a role in maintaining blood pressure levels, since it upregulates alpha-1 adrenergic receptors in blood vessels, which causes vasoconstriction. Now, there are only a few pathological conditions where the corticosteroid level in the body is lower than normal. For example, primary adrenal insufficiency, also known as Addison's disease. The reason it's called primary is that the underlying problem is due to damage to the adrenal glands themselves. When the cortisol levels fall, it causes a decrease in immunity, which in turn leads to frequent infection and further increases the stress. Low cortisol levels also lead to inadequate glucose levels during times of stress. This is known as Addisonian crisis or acute primary adrenal insufficiency. Left untreated, Addisonian crisis can be fatal. Another pathological condition with low corticosteroid levels is congenital adrenal hyperplasia. This is caused by genetic defects that prevent the synthesis of specific enzymes that make cortisol. Now, synthetic glucocorticoids can be given to treat Addison's disease, but they are more commonly used as anti-inflammatory agents to treat diseases like rheumatoid arthritis, and immunosuppressants to treat chronic asthma and autoimmune diseases, like systemic lupus erythematosus. Based on the duration of action, synthetic glucocorticoids can be classified into three groups. The first group includes glucocorticoids with short duration of action. Hydrocortisone falls under this group. It's chemically identical to cortisol and can be taken orally, intravenously, or intramuscularly. It then enters into the circulation, goes to the target cells, and very rapidly takes effect, but only for a short duration of time. That's why hydrocortisone is the drug of choice in acute adrenal insufficiency. It's also used in topical forms to treat various inflammatory skin conditions and allergic rashes. The second group are the glucocorticoids with intermediate duration of action. Prednisone, prednisolone, and methylprednisolone fall under this group. These medications are given per oral or by injection into a vein or muscle. In comparison to hydrocortisone, medications of this group are almost 4 to 5 times more potent, meaning a lesser dose is needed to produce the desired response. These medications are used as an anti-inflammatory and immunosuppressive agent to reduce the severity and extent of inflammation in certain inflammatory diseases like asthma, or to treat autoimmune conditions like rheumatoid arthritis. For example, intravenous prednisone is the drug of choice for an acute attack of asthma. Finally, the third group includes synthetic glucocorticoids with long duration of action, like dexamethasone. They are taken per oral, injected into a vein or muscle, or used in an inhaler to treat chronic asthma. Dexamethasone is a very potent medication and often causes marked suppression of the pituitary-adrenal axis, even if given in a low dose, meaning dexamethasone provides a negative feedback to the pituitary gland, which leads to suppression of ACTH secretion. This, in turn, lowers the natural production of cortisol. Due to this, it's used in the overnight dexamethasone suppression test, where it's used to diagnose the presence of Cushing's syndrome. Cushing's syndrome is an endocrine disorder caused by too much cortisol production. It could be caused by Cushing disease, where a pituitary adenoma overproduces ACTH. Symptoms include obesity, where the extra adipose tissue tends to build up between the shoulders, leading to a buffalo hump, in the trunk, causing truncal obesity, and in the face, causing moon facies. Hyperglycemia and diabetes often result from the increased gluconeogenesis and insulin resistance. Muscle weakness and skin stretch marks can occur due to protein breakdown. Hypertension, osteoporosis, and increased risk of bacterial and fungal infections are also common problems caused by excessive cortisol. Now, when a person is suspected to have Cushing's syndrome, they are given a low dose of dexamethasone, which suppresses ACTH production in the pituitary gland. Normally, that should cause a decrease in serum cortisol levels. But if Cushing's syndrome is caused by endogenous cortisol production, then the cortisol level should remain unchanged. High cortisol levels determine the test as positive, and it proves the presence of Cushing's syndrome. Side effects of all the synthetic glucocorticoids are pretty similar to Cushing's syndrome, since they act just like the cortisol produced by the adrenal glands. When we get these symptoms from an outside source, it's called iatrogenic Cushing's syndrome. This is actually more common than regular Cushing's syndrome, since glucocorticoids are frequently used to treat fairly common disorders like rheumatoid arthritis and asthma. Now, we've made a mnemonic to help you retain some of the hard-to-remember facts related to the synthetic glucocorticoids. To start, let's think of a crazy 3-story apartment, where each level only has one room, and the room size decreases as we go towards the top. So the long-duration glucocorticoids get the room at the bottom, the intermediate in the middle, and the short duration at the top. Okay, since most of our glucocorticoids contain SON in their names, we'll have suns representing these medications. So on the top floor, we'll have hydrocortisone, which will be represented by a boy in a pool playing water polo. For indications, let's have him play water polo against Thomas Edison, who's holding a light bulb. Now, mixing electricity and water is dangerous, which helps you remember that hydrocortisone is used to treat the life-threatening Addisonian crisis. He also has a bunch of rashes all over to represent this medication's topical uses. Okay, on the next floor down, we have the intermediate duration glucocorticoids. So here we have 3 medications with the pred in them. So let's dress up 3 boys in predatory shark costumes to represent prednisone, prednisolone, and methylprednisolone. Now their room is on fire, so one of them is putting it out with a fire extinguisher to represent their anti-inflammatory properties. Another one is eating one of the misbehaving white blood cells that set the fire to help you remember that they can be used for autoimmune diseases. Finally, prednisolone is holding the asthma inhaler to help you remember it's the glucocorticoid of choice for chronic asthma. Okay, let's go to the last room, which represents the long-duration glucocorticoids. So here we have a boy named Dexter who's doing math for dexamethasone. He's calculating the force needed to crush different materials for his experimental trash compactor, which represents its use to diagnose Cushing syndrome. The misbehaving white blood cells also spread to his floor and are setting fire to the room, so dexamethasone can also be used to treat the same conditions as the intermediate duration glucocorticoids. Now let's head out of the building for the side effects. We have a trash compactor outside for iatrogenic Cushing syndrome, which is caused by glucocorticoids not produced inside the body. So to help you remember some of the symptoms, let's put some stuff in this trash compactor. There's a buffalo with a fat torso, wearing a smiling moon mask to help represent buffalo hump, truncal obesity, and moon facies. We can put a blood pressure cuff wrapped around a bone with holes in it for hypertension and osteoporosis. Finally, there's an obese man eating a candy bar to represent hyperglycemia and diabetes. There's bacteria climbing around him to represent an increased risk for infections. Alright, as a quick recap, glucocorticoids can be used in hormone replacement therapy in adrenal disorders like primary adrenal insufficiency or congenital adrenal hypoplasia. However, they are more commonly used as anti-inflammatory agents and immunosuppressants. Synthetic glucocorticoids include hydrocortisone, which has a short duration of action, medications like prednisone, prednisolone, and methylprednisolone, which have intermediate duration of action, and dexamethasone, which has a long duration of action. These synthetic glucocorticoids have very potent anti-inflammatory activity. But wait, there's more. Here's a mind map with all the mnemonics. Go ahead and pause the video so you can test yourself and see what you remember. Stay tuned for the answers after the credits.